Hello everybody. I'm going to be talking to you guys about piano-related hand injuries today. I'm going to go in depth about some of the injuries you could come across while playing the piano, some things you have to look out for, some ways you can avoid them, some things you can do to heal them if you have them, and I'm going to go over at the very end some fun, nifty ways that you should never try that people tried to avoid these injuries, because there was a time when people noticed that this was a problem and got very, very scared and didn't know what to do, so they just tried everything. But without further ado, let's get started. First thing, you should know the difference between fatigue and pain. If you're fatigued, you're just kind of tired from long playing. This will build up sort of gradually, although it might sort of grow exponentially, but it'll still be like a gradual increase in that sense. Like it won't be like a jump. A little rest in this scenario will help. It's not anything super serious. It's sort of like being tired and sore from a workout. It'll feel similar, but like in your fingers. Whereas if you're having actual like pain, something that you should probably look into, it's going to be sudden and sharp. It'll be typically found in a joint. You might be accompanied by some swelling. It'll hurt to move, and it will prevent you from playing. Like you won't be able to use that finger, probably. It'll be akin to having sort of like an actual injury from the workout, sort of like I mentioned earlier. Or it's sort of like being sore. If you're just kind of tired, this will be like having an actual injury. If you've ever experienced one, you'll know the difference there for sure. Okay, so probably the most common cause of pain you're going to hear about is tendinitis. It is basically the inflammation and irritation of a tendon. In the case of pianist, it's going to be in your finger, maybe your wrist, possibly your elbows and shoulders. I kind of doubt it. You're mostly going to do all the fine movements with your wrists and fingers. Symptoms of tendinitis include pain, tenderness, and swelling around a joint. It'll get puffy, it'll get red, it might get purple. It'll hurt to touch and squeeze and play on. It can be due to many things. These many things can cause it, that is to say. Either improper technique, playing excessively, playing things that are too hard for you, which kind of falls into that category. Things along those lines. Okay, another cause of pain that you might run into or hear about in sort of looking into this subject matter is carpal tunnel syndrome. This is typically genetic, but it can be acquired mechanically through some flaws I'm going to get into in a bit. Basically, this is a condition where the median nerve, which is a nerve, as you can see, that sort of connects your wrist to your arm, is compressed as you move your wrist, fingers, hand, etc. Symptoms of this will include pain and numbness and tingling, things that you would associate with a nerve being pinched. It'll be concentrated in like some of your fingers, either your pinky or one side or the other or both. It'll tend to get worse over time. It doesn't tend to heal itself, so if you feel like you might have carpal tunnel, you're going to want to go see a doctor. It can cause really long-lasting nerve damage if it goes on for too long, so that's especially why you want to get into that, because that doesn't really heal. It can be due to, again, excessive playing, improper technique, genetics, you name it, there's a way you can get it. And again, we'll get into sort of what these improper techniques are and what you can do to improve them in a minute. Things that can help prevent your injury, of course, it sounds corny, but you should always warm up before you play. Never just jump straight into a practice. Especially if you're going to be playing something kind of challenging, you always want to do some exercises before playing. You can do stretches. I'll get into some examples of those in a minute. You can do scales, basic chords, some rhythms, just a whole bunch of exercises you can do to sort of get yourself warm. Just like when you're getting ready for a workout, you want to sort of get yourself warm. You want to ease into hard pieces. If you haven't been playing super hard pieces recently, you're going to want to, if you want to learn a new one and you've been playing some easier pieces recently, start slow and sort of ease into it. Or if it's like a multi-movement piece, if there's a slower movement, you could probably pick up the slower movement first. You name it, there's a way to do it. Pace yourself is what I'm trying to say here. Also, sure you're quite literally warmed up. It's actually bad to play with cold hands. There's a reason why it's kind of hard to move them. It gets slow. Basically, blood flow is restricted and you can't feel as much, which means you're more liable to have an injury. Some other things that can help you prevent injury are, of course, taking breaks. If you ever want to play a hard piece for too long, and a hard piece is of course a relative term. People are used to different difficulties, but this can exhaust your fingers and make you more prone to injuries, such as what I've mentioned before. Good practice is to practice in multiple short blocks rather than just like one big one. But your mileage may vary as to what defines a short block. I've written here 30 minutes to an hour tops, but that is subjective. And it depends, of course, on the pieces you're playing. If you're playing something super easy, you can probably go a lot longer. Your body will also, it'll let you know if something's wrong. So if it hurts, don't try to power through the pain. Don't be a superhero. It won't get better. It's just if you try to play through the pain, you're more liable to have larger or worse injury than you may or may not already have. So it's better to just stop, take a break, stretch, and that'll allow for your hands to heal. Okay, some things that can help alleviate pain, if you already have some, are some accessories like compression gloves. As you can see here on the right, I've actually seen these marketed towards musicians on like Instagram in adverts. And basically what these do is they sort of apply pressure to areas where there are joints, or really all around your hand, but like specifically around the joints that are affected, because those are going to be the places pushing against them the most, and that alleviates pain. It accomplishes this by sort of forcing blood to flow faster in these areas, which will narrow your blood vessels and increase your blood pressure. But by doing so, they will cause inflammation to sort of go down, because the blood is sort of forced to move out and it can't really pool in there. Also, these will keep your fingers warm if they're cold. That's something to keep in mind. Don't want to play with cold hands. Of course, it says on the right, these are good for tendonitis and carpal tunnel, even arthritis if you have problems with that, muscles, joints, you name it, this will help. Other things that help alleviate pain are some stretches, like you see on the right. You can do these wrist stretches where you sort of grab one hand and push your hand back and forth. You can do similar things with your fingers individually. You can also do this thing called hot cold therapy, which basically means if something hurts, you want to put it in warm water, sort of like taking a hot bath or a sink, or if you have access to a hot tub, that'd be perfect. And then you want to put it on ice a little while afterwards. These will sort of help accelerate the healing process. This sounds corny, but diet and exercise, eating less salts, will prevent inflammation in the long run, because water pools around salt. So the more salt you have in your system, the more liable you are to inflame. Of course, you should always allow your hands to rest. It goes along with taking breaks, but like I mentioned before, but if it gets too bad, chances are doctors will want you to start playing for a lot longer. So it's your choice between like 10 minutes and 10 days, or even 10 weeks if it gets really bad. All right, now I'm going to get into some fun ways that you should not try, that people try to sort of avoid hand injuries and sort of improve technique at the same time. This was a device created by Benjamin Atkins in 1881. He quoted as saying it is a new and useful device for supporting and exercising the fingers of players on a keyboard instruments. As you can see, it sort of provides support to each of these fingers with these like wires attached by hooks to these rings that you put each of your fingers through, and you sort of screw it onto your hand. It's got a pad for comfort, of course. Now, this can sort of restrict your hand movement and cause some other unforeseen injuries. Of course, here's more or less the same product shown from a different angle, so you can get a better look at some of these like spring-loaded wire things. Almost looks like the bridge of a guitar, if you think about it. And basically, it says in this really low-quality image that these like strengthen the fingers, improve touch, and basically increase your flexibility and rapidity. And it sort of forces you to the correct position of the hand. Although that's very subjective, there are a lot of different techniques out there. So to say one correct one, there's a better one for preventing injuries and stuff. Restricting your hand this much probably just isn't the right idea. I don't know. What do you think? Let me know in the comment section down below. Of course, we've also got this lovely device. Looks like something out of a torture film. You've seen those old illustrations of like a guillotine. It looks like one of those with the weird patent. And basically this is something that was designed to sort of stretch out your fingers. And in a way, it's sort of looks like they were going for some of the same stretches I was showing you earlier, but with your fingers specifically. Of course, leaving your hand in this position can actually cause some problems, like overstretching, hyperextending. If you don't get the pressure right on those little knobs right here, that could cause some blood buildup in your fingers while you're doing this, and you can maybe pop some blood vessels, which will not be fun. So this can cause a lot of problems, and those are just some fun ways people tried to avoid these injuries in the past. Don't try those. Do not use these. I don't know if they exist. Well, they probably exist somewhere, but don't. Please, just go for the compression gloves. These are good for you. All right. Thank you very much for watching. I hope you enjoyed this little video lecture thing. Have a nice day.